Welcome to my channel. I am Dr. Anitha. Today we are going to see about the heart sounds. So what are the types of heart sounds, how it is produced and its abnormality. Let's see. So there are about 4 types of the heart sound: S1, S2, S3 and S4, and added sounds like clicks and snaps. These 4 heart sounds has been recorded in a phonocardiography, but only the first and second heart sounds can normally heard with a stethoscope. Before we are going to see about, I'm going to tell about the parts of the stethoscope like bell and diaphragm. The bell of the stethoscope is used to hear about the low-pitched heart sounds like S3 and S4, whereas the diaphragm of the stethoscope is used to hear about the high-pitched heart sounds. Next is the location of the auscultation. So there are the 4 areas we are going to auscultate. This is the mitral area, tricuspid area, pulmonary area and aortic area. So first is the mitral area in the left 5th intercostal space, half inch medial to the mid-clavicular line. And tricuspid area is 4th intercostal space close to the sternum. Whereas in the pulmonary area is the left 2nd intercostal space close to the sternum. And aortic area is right 2nd intercostal space close to the sternum. So now the position of the auscultation. For each area there is a different auscultation position. So for the mitral area, in the supine position and left lateral position is ideal, whereas in the aortic and pulmonary area is sitting and leaning forward is the best for auscultation. So now in detail about the heart sounds. The first heart sound, that is the S1, so is the lub, is produced because of the closure of the atrioventricular valve at the beginning of the systole. It is best heard at the apex of the heart with the bell of the stethoscope. And the abnormality of the first heart sounds like loud S1, soft S1 and variable S1. So the loud S1 is produced because of the hyperdynamic circulation like in exercise, fever and mitral stenosis and Wolff-Parkinson-White syndrome. Whereas the soft S1 is produced in the low cardiac output failure and calcified valves like that. And variable first heart sound in case of the atrial fibrillation and complete heart block. And second heart sound, that is a dub, is produced because of the closure of the semilunar valves at the end of the systole. This is best heard at the base of the heart. So abnormal second heart sound like loud S2, the A2 component in case of the systemic hypertension and congenital aortic stenosis. Whereas the soft S2 in case of the calcified aortic stenosis, and loud S2 because of the pulmonary component in case of the pulmonary hypertension. So that's about the first and second heart sound. Lub, dub, lub, dub. Lub is S1, dub is S2. Next to move on to third heart sound, S3. Is the, already I told, is a low pitched heart sound, occurs in an early diastole. Is lub, dub, slosh. So it's produced because of the forcing of the blood into the ventricle beyond its range because of atrial overload. It occurs in a congestive cardiac failure. Yes, S3 is a low pitched heart sound, occurs in a congestive cardiac failure. And S4 again is a low pitched heart sound, occurs in a late diastole like li, lub, dub. It occurs because of atrial kick in a non-compliant ventricle. Next is the click. Click is the abnormal dooming and prolapse of the diseased valve. For example, in case of the ejection systolic click occurs in a mitral valve prolapse. And snap. Snap is a high-pitched diastolic sound produced because of opening of the stenosed mitral and tricuspid valve in a variable distance of S2 followed by a mitral stenosis diastolic murmur. Opening snap is more common in mitral stenosis. Now you have know the whole new meaning of phrase, listen to your heart. Thank you.